Okay, so we do have three presentations. For logistics, we will go through each of the presentations, and then we'll have time afterwards for questions. I prepared several discussion questions. If there are questions from participants, then feel free to pose the questions during the chat, and that way the speakers can see them afterwards. But we'll wait until after all three presentations have been completed before we turn to the question period. If you are not presenting, I encourage you to turn off your microphone. If you are presenting, obviously, it'd be great if you could turn on your microphone. Each presenter will have, about 15 minutes for the presentation, right? And then, as I mentioned, we'll do questions afterwards. The first presentation is from Reynes Abu Kujo, who is not yet in the Zoom room, but hopefully will be here soon. We do have their pre-recorded presentation, which is great. Reynes is from Ghana and is a postgraduate student at Shanghai University doing his Master's of Science, majoring in international trade and economics. The presentation is called CSR, or Corporate Social Responsibility, Response to COVID-19 in Africa Towards Healthy Cities. But before we begin, I just want to kind of open up and welcome everyone to the thematic area in the panel, which is about urban health in the era of COVID-19, right? Let's provide a short introduction as we're waiting for the presentation. So as we know, the link between health and urban development has been known for a long time, right? Even before the pandemic, the topic of urban health had gained increasing attention as a result of ongoing growth and urbanization in cities across the world. We know that urbanization has increased the problems caused by health crises. Cities are growing at an alarming rate, and this has led to, in many cases, uneven distribution of populations, and in some cases, disorganized urban landscapes. It also signifies that not everyone has equal access to resources to help mitigate challenges that result from these crises. In the era of COVID-19, the importance of urban health has been amplified 100-fold. In addition to the extreme health impacts and loss of life as a result of COVID, it has also laid bare the economic and social repercussions of health crises when they are not managed properly. Global experiences with the coronavirus have emphasized the need to incorporate a healthcare perspective into urban planning and development in order to effectively deal with current and future health crises like COVID-19. Today, we have three very interesting presentations that touch on different aspects of urban health in the era of COVID-19. And so I welcome everyone who is presenting and who is joining out of interest. I see we have a couple more people, and so just a reminder that we will go through each of the presentations one by one, and then afterwards we'll have time for questions. Feel free to put your questions in the Zoom room chat, or to save them to ask after all three presentations are done. I do see that Reynes has joined us, so that's great. Reynes, good morning. We are about to start. Good morning. So we are about to start your pre-recorded presentation. And for context, I'll introduce you again. Reynes is from Ghana, is a postgraduate student at Shanghai University doing his MSci, majoring in international trade and economics. So without further ado, I'll turn it over to the technical support to begin the first presentation.
Thank you. Hello, everyone. Welcome to the fourth ICCCASU conference. It is unfortunate that the conference couldn't be held offline because of the crisis the world is dealing with, but I'm very sure this online meeting is equally successful as it would have been offline. I'm honored to be part of the fourth ICCCASU conference on the particular thematic area of discussion concerning the environment, how we for the average and the poor all over the world. For this reason, my study was on corporate social responsibility response to COVID-19 in Africa towards healthy cities. I'm 28 years of age. I'm a Ghanaian and I'm affiliated to Shanghai University School of Economics. I'm a postgraduate student and I major in international trade and economics. Responsibility is a well-known aspect of companies' engagement within the local community. However, there are many other options for CSR to benefit the world in a positive way, such as through human rights and environmental protection, and also through the support for the local community in times of crisis. The main objective of this study was to ascertain how CSR can be used to establish and maintain citizen health within African cities. We analyzed the role of CSR in Africa, and also we analyzed how companies have used CSR in the COVID-19 pandemic. And finally, we analyzed how healthy cities can be established and maintained within Africa. On these objectives, we asked the following questions. 1. How have African companies engaged in CSR in general? How has COVID-19 impacted Africa? How have African companies used CSR during the pandemic? And finally, how can healthy cities be established and maintained using CSR? Adopted research method. This study was conducted based on a systematic literature review with the explicit goal of making a synthesis on current literature. This type of synthesis is for the purpose of providing a summary of current literature to draw new conclusions. There are 5 stages in which the systematic review is conducted. The step was to develop the research question. This was done in the introduction based on the background, the research aim, and the research objectives. Then we moved to the relevant data search. Over here, the inclusion criteria must be developed for the present study. Therefore, the search engine of choice was Google Scholar. As the topic is current, it was expected that the majority will be from 2020 or 2021. However, for discussions of CSR in African countries, sources may be older, with the cutoff being set at 2010, with the acknowledgement that seminal information might be slightly older, with 2005 being the cutoff point. Search engines were used in conjunction with one another using the Boolean operator, and the terms were COVID-19, corporate social responsibility, CSR, Africa, Nigeria, Ethiopia, Egypt, South Africa, and Madagascar. The Quality Assessment Score, which is based on Downs and Black 1998 quality assessment, were required to be at least 5. Since the study is literature review, all studies with the exception of those for the methodology were shown in the completed quality assessment matrix. Now, the third step of the methodology is the data eligibility. The goal of this stage was to ensure the source met the quality assessment requirements. The questions were answered based on a yes, which is 1 point, and on a no, which is 0 point. These points were summed in the matrix. The questions were: 1. Was the source related to the interest? 2. Was the source within time frame allowed? 3. Was the source written in a logical manner? 4. Were the objectives of the source found early in the document? 5. Were there clear methodological process? 6. Were the findings based on the methodology and relevant to the objectives of the source? And finally, did the author offer conclusions and recommendations that were relevant to the objectives of the source? Now, this takes us to the fourth step of the methodology, that is the data extraction. Information that was relevant to the topic was extracted for synthesis and analysis. Now, at the final stage of the methodology, we did the data analysis. The data extracted in the prior step was analyzed to establish a new outcome. This takes us to the discussion of the study. The discussion was made based on 5 African countries, and these are Nigeria, Ethiopia, Egypt, South Africa, and Madagascar. So in Nigeria, we found out that CSR activities by multinational oil companies have had no to a limited impact on the lives of the people living in the Niger Delta region. In Ethiopia, the short-term reactive CSR approach with effects on market orientation, financial and marketing performance skills with the lack of environmental and social elements. In Egypt, we found out that CSR affects marketing and public relations as well as lack of partnership model and vision. This means less effect on environment. Now, when we came to South Africa, we found out that CSR activities by construction companies have shown high level of environmental impact as well as countrywide social and economic development. And finally, in Madagascar, in relation to the environment, mining companies faces significant difficulties engaging in CSR activities due to conflicting interests of the community and the local government appointees. So based on this discussion, and this is the conclusion, it should be noted that while there are findings regarding CSR used by African companies for the creation of healthy cities, no African state had a comprehensive approach, and the ones that do participate in CSR provide scanty effort at best. Therefore, the conclusions presented are based on the general findings, which is based on the studies shown. The most important element which should be noted is that no African company, or at least any African company or any foreign company which is headquartered in Africa, took a significant effort to resolve COVID-19 pandemic problems within the community. I drew 6 recommendations, and the first one is CSR drivers should be based on cultural traits which will help companies treat COVID-19 needs based on the cultural needs of the African cities. Secondly, social expectations should be integrated into CSR initiatives which will assist companies in providing most needed products and services, leading to improved health within the community. The recommendation is financial institutions and other institutions should seek to positively contribute to local businesses, which can help stimulate the economy. Also, CSR disclosures should include COVID-19 pandemic related statements, which can contribute to the creation of healthy African cities because of the increased likelihood that the company will make good on the promises made. The fifth recommendation is companies should review their governance for nature and quality based on societal expectations. And the final recommendations is, although the stock returns are not the major element of resolving challenges related to the COVID-19 pandemic and the creation of healthy African cities, they are important in the consideration of economic health and improved stewardship. So, based on these recommendations, we can together build a healthy cities within the African countries and the various communities. So this brings us to the end of the presentation. I'd like to acknowledge Shanghai University School of Economics, and also I would give a very big thanks to my advisor throughout the research, Professor Hong Wan, that is an associate professor at the School of Economics, Shanghai University. Thank you for having me.
Great. So Reynes, thank you very much for that presentation. Just a reminder that we will be doing questions after all three presentations have been completed. You can put questions into the chat. If people want to put questions for Reynes into the chat, please feel free to do so, or you can wait until the end of all three presentations. I know I have a few. I found that very interesting, and the intersection between government and the private sector and that they have in supporting responses to COVID-19 is a very interesting and important topic. And I will have some questions that I'll put in the chat for you during the next presentation.
Thank you, sir.
Turning to the second presentation. The second presentation is by Thanusha, and Thanusha, please apologize. I apologize in advance. Ratnasapapati. I hope I got that right. Thanusha is the founder of From the T5Pa and is a recent graduate from the International Development and Globalization School at the University of Ottawa in Canada. She has conducted policy research for government agencies, non-governmental organizations, and the intergovernmental organizations. Her aspirations are to work within the UN and to contribute to innovation and policy work. She lives in Brampton, Ontario, which is near Toronto, Canada, and which has been one of the hottest spots for COVID-19 during the pandemic. And she decided to conduct research on urban health equity within visible minority communities. Great. So is the presentation for Thanusha loaded for the pre-recorded presentation?
Hello. Hello.
Hi.
Okay.
So I think we're just waiting a minute or two for the perfect.
Excuse me, we have some technical issues, but just a few minutes. Thank you.
So I guess we'll just give them a couple of minutes to load Thanusha's presentation. In the meantime, I think maybe we could open it up for questions for Reynes. If anyone has questions, I would like to start the discussion. And so, Reynes, I have a question for you. I found it really interesting how you looked at.
It's okay.
Do you have the presentation?
Yes. Please, can you say to me if you can hear the presentation, of if you can see the video, please?
I cannot see the video.
I will share my screen right now.
You win your breeze, I'm baby son.
Okay, yes, I can see your screen.
Hi everyone, thank you so much for joining this panel.
Yes, it
I'm
works.
so excited to be presenting my research and recommendations to you about urban health equity. And today specifically, I will be discussing vaccine distribution in a pandemic, where we will be uncovering the socioeconomic inequities in specifically neighborhood level vaccine delivery. A little bit about myself. I am a graduate from the University of Ottawa, located in Canada. I have a bachelor's of social sciences with a specialization in international development and globalization, and I've done a variety of research work with faculty of laws, health science, as well as international development and global studies. My particular interests around social innovation and strategic policy. I'm also the founder of my very own social innovation-based communication platform for the Tamil community, both in diaspora and within Sri Lanka, where I advocate for Tamil rights and create a global community through innovative projects. I'm going to start off this presentation with this quote: "Where in the city you live and how that city is governed can determine whether or not one benefits from city living." And this quote exemplifies exactly what urban equity is in its fullest form. And as we'll see today, how this can apply to urban health equity. So this understanding is very crucial to equity in future pandemic programming. In this research, using literature reviews and secondary data, I tackled these three research questions. Are there similarities between urban inequities of past pandemics and that of the COVID-19 vaccines? So specifically, we'll be looking at existing research on the Ebola epidemic. How has a globalized era created an increased divide of vaccine inequities for vulnerable and disadvantaged communities? And how can equity frameworks be shaped for vaccine distribution? So what are recommendations that can shape the future of vaccine distribution? I would also like to highlight certain definitions. So when I address the social determinants of health, it refers to a specific group of social and economic factors within the broader determinants of health. So these relate to an individual's place in society, such as income, education, or even employment. Equity specifically within health is the complete absence of systematic disparities in health, with consideration for the major social determinants of health between groups with different levels of underlying social advantage or social disadvantage. So these strong indicators will include wealth, power, and prestige. So in terms of urban health equity, rapidly growing new cities and increasingly segregated older cities in the global north and south are contributing to health inequities. And this will be identified as urban health equity. So with the Employment Equity Act, we have determined visible minorities as persons other than Aboriginal peoples who are non-Caucasian in race or non-white in color. So these definitions will help us throughout the research plan. The outbreak of Ebola virus disease was one of the worst in history, reaching ends from Africa to Europe and North America, reaching global attention and concern. But as a result, many governments, global funding institutions, donors, they all raced to provide financial and human resources to support the epidemic that was growing in West Africa. Most of the optimal intensive care services that were needed were typically surrounded in resource-rich countries and unavailable in resource-poor countries. More specifically, this deprivation found on an international level was also applicable to the neighborhood level, which we're going to discover a little bit more today. So a variety of factors have played a role in Ebola spread, as stated within multiple literature reviews, whether that be poverty, inadequate health infrastructure, or the region's history. But what was considered an elephant in the room in the international discourse concerning this epidemic was urban informal human settlements, or slums. So the UN defines slums as settlements with inadequate access to safe water, sanitation, and other infrastructure, poor structural housing quality, overcrowding, and insecure residential status. So these conditions are considered perfect for the spread of the virus. So previously reported outbreaks of Ebola occurred specifically within rural and geographically isolated communities, specifically where visible minorities are, and areas that are inaccessible for vaccine distribution and delivery, especially due to the lack of roads and infrastructures that are needed for vaccine storage. One of the key things that inhibited vaccine distribution within the Ebola epidemic was the disruption in medical care with the lack of health staff, infection control, contact tracing, epidemiological surveillance, alert and referral systems, community mobilizations, and education. So this was specifically looking at it on a local level. In addition, strong levels of mistrust, miscommunication, and rumors that strengthened community resistance limited public health measures in these local areas. Urban households were also more likely than rural households to report higher levels of exposure of the outbreak. The existing research showcases a lack of research surrounding the inequities of vaccine distribution within the neighborhood level. In summary, we found that the role of vaccination strategies in containing the Ebola spread significantly depended on the level of community accessibility. On top of this, in order to enhance the effectiveness of control interventions, it is crucial to ensure community engagement to public health initiatives. Vaccine issues came up when it comes to listing and identifying contact of patients who present to one or more community clinics, where record keeping is very poor in these areas, and working among families and communities that are being reluctant to cooperate. There remains a challenge of finding contacts and detecting early symptoms, especially given the state of health facilities and how far apart these facilities are. Moreover, mobile population often were fearful of the response effort, with individuals often hiding, refusing to subject themselves to follow-up examinations or traveling. There was heavy distrust. These specific areas, as you can see on the screen, within DRC and the minorities within them, typically lived in areas where vaccinations cannot reach them. And as you can see, it led to the increase of cases of the Ebola virus. Some of the lessons that should have been learned is that there is a need for increased accessibility for effective contact tracing, accessibility of vaccines in hotspots specifically, increased education-oriented and culturally tailored education programs, the need of proper infrastructure, and altogether just the lack of vaccine equity research for visible minorities that can contribute to future programming. So what we're going to look at through this project, this paper is the framework for spatial urban health equity indicators, which allows us to map the relationship between exposure and health effects determined by a variety of drivers, and therefore actually is able to reveal the explicit entry point for intervention and exactly where we should start programming. It combines elements of cause-effect indicator frameworks with elements of health equity models. While driving forces such as traffic density, public spending, or urban development might occur on these multiple spatial scales, the variables including environmental and social factors are captured in indicators as variables, which is very good within this framework, including a variety of neighborhood level and city level factors. Exposure variables finally are mapped on a neighborhood level. So the existing research on vaccine distribution, especially for past pandemic, lacks an equity lens specifically based for visible minorities. In this map, you will see the coronavirus cases within the Greater Toronto area, but today we will be specifically focusing on Toronto through M postal codes and elsewhere surrounding L postal codes in comparison with surrounding postal codes. So my research specifically uses the index of dissimilarity found through the information provided by Ivanuk and Leon. This existing research basically showcases how unevenly vaccinations are distributed across neighborhoods. So it produces a number ranging from 0 to 1, which shows the proportion of the population that would have to be relocated to create a completely even distribution. So a score of 0.5 would mean that half the population would have to be relocated. That is, it shows how much of the population would have to be moved around to obtain evenness. This paper uses this index to basically show how unevenly vaccines are distributed across Toronto neighborhoods, and then investigates how well vaccination rates match the cumulative COVID-19 burden as stated by Ivanuk and Leon. What we have here is the numbers showcase that vaccination coverage is pretty much fairly even across Ontario neighborhoods. So between 12 to 15% of vaccinations will need to be redistributed for an even distribution across neighborhoods. When considering Ontario as a whole, cumulative COVID-19 rates in a neighborhood were positive associated with vaccinations rates once poverty rates, age composition, and racialized groups were taken into consideration. On the other hand, the M postal codes had overall higher rates of vaccination compared to other regions. Percents of South Asians, Blacks, and Latin Americans were associated with lower rates of vaccinations. percent aged 65 and older was associated with higher rates of vaccination. All other associations were insignificant in this case, as stated again by Leon. Again, however, some of these associations varied by region. So this figure shows that in Toronto, and to a lesser extent in the neighborhoods around Toronto, this is a key thing to notice. There is a negative association between COVID-19 rates and vaccination. So there's a seeming mismatch, as they state, between need and supply. However, in the rest of Ontario, the association is slightly positive. So areas that have been harder hit by COVID-19 are those that have the highest vaccination rates. There's also a significant interaction between region and neighborhood, as well as taking into consideration neighborhood property. So this basically takes a look at the negative association when it comes to racial demographics and region. So you can see that there is a negative association, and this also continues for Southeast Asians and Latin Americans. So the analysis that we discovered showcased that Ontario is not concentrating its vaccination efforts in places with the highest rates of illness, and that the province is not distributing vaccines in an equitable way to areas with racialized populations and low-income neighborhoods. That's the specific focus we need to take on. Furthermore, Toronto appears to have distinctly inequitable processes underway where neighborhood poverty, racialization, and COVID-19 rates are negatively associated with vaccination rate. Systemic income inequality and systemic structural racism are both factors that need to be addressed. Moving forward, I offer 6 recommendations that can shape vaccine distribution to be more equitable for specifically vaccine distribution. So the first thing we can take a look at is increasing initial routine socio-demographic data. So the public health did not initially collect a socio-demographic data when the pandemic was first announced. So these analysis reported that COVID-19 rates were 10 times higher in some areas, and the best predictors were the percentage of racialized populations in an area and an income, which could have been useful for programming earlier on. The third thing we should be looking at is targeted tracing. So by targeting contact tracing with areas that have been the hardest hit and areas with specifically vulnerable populations, whether that be through different type of housing, whether that be through different types of urbanized cities, a specific neighborhood over another neighborhood. In that way, we will be able to address socioeconomic differences and contribute to equitable vaccine distribution. The fourth recommendation is understanding multi-generational households as a barrier. So we actually must place multi-generational households near the top of the COVID-19 vaccine priority list. My fifth recommendation is that vaccine efforts should focus on not only gaining public trust, but engaging the local public with not only policymakers, but as well as scientists in order for them to engage and build that trust. And on top of that, doing that in a culturally informed manner and respectful of all cultures within these visible minority communities. And lastly, understanding limited English proficiency as a barrier. So many visible minorities, English becomes their second or third language. So vaccine efforts need to be available to the top majority languages in a city, but as well as translatable for minority languages. So paying a lot of focus in terms of that, because even then direct translation can miss the overall context. So paying a lot of focus to how individuals are understanding COVID-19 and the reason why we are getting vaccinated. Thank you so much for listening to my presentation, and I look forward to hearing my next colleague talk more about urban health during these hard times. Hi everyone, thank you so much for joining this panel today.
Great, so Tanusha, thank you very much. Also a very interesting presentation. I think especially once we're starting to see these presentations back to back, whereas Rainis was really focusing on the role that corporations in the private sector can play in the COVID response. You looked at the impact and the outcomes of what government, methods and responses have been, and provide some interesting recommendations there. I will put some questions for discussions in the chat for you as well as we move on to the third presentation. tech support, are you able to load the third presentation, or is this one that we should do live?
So I will share my screen and you will see if it's working.
Great. So as we're waiting for you to do that, I will introduce the third speaker. The third speaker is Emmanuel Michael Diruriza from UN Habitat in Nairobi. Emmanuel is a renewable energy and energy access expert with more than 16 years of experience in the sector. He works at UN Habitat based in Nairobi as a urban energy specialist, focusing on low carbon and resilient urban development using renewable energy resources to enhance energy access and energy efficiency measures in urban settings. Emmanuel holds a Master of Science degree in energy management from the University of Twente in the Netherlands. And so welcome you, Emmanuel, and your presentation. We can see the presentation, so let's get started.
Good morning, good afternoon, everybody, wherever you are. I have a great honor to present to you the aspect of energy access for the urban poor in the situation where we are facing a COVID-19 pandemic. My name is Emmanuel. I'm energy specialist at the UN Habitat based in Nairobi, Kenya. And with me in this presentation is Vincent Kitio, who is the Chief of Energy, Urban Energy Solutions at UN Habitat in Nairobi. So our presentation actually has got 5 points. I will take you through a background and how did we come up with some of the ideas that I'm going to present to you, and looking at the situation prevailing during the COVID pandemic, and of course in line with the energy access aspect, but also trying to narrow down a little bit on UN Habitat response to the COVID-19, and some discussions of what can be done and what else should be possibly the best solutions to curb the situation. As of course everybody knows, the COVID-19 pandemic has brought all sorts of challenges in the daily life. Speaking of the urban areas, like 95% of the cases have been accounted from the urban areas, and making the urban settings to be the epicenter of this pandemic. And of course, we all know the WHO has provided some guidelines, and many countries across the world have been instituting different measures to try and curb the problem. And the fact that the energy access is a cross-cutting issue, much as we talk of the pandemic as a health issue, but energy plays a crucial role, looking at issues of water supply, staying at home, even mobility aspect, etc. Now we have, of course, witnessed people working from home, and at the same time, much as it's a problem, but we see the pandemic has brought some opportunities for the countries to now definitely initiate the transition towards green economy, looking at the low carbon development by building back better and greener economies. Our methodology, as I said, has narrowed down to looking into the measures that have been instituted by the WHO, but of course looking at the current practice to try to go in line with what is required to try and reduce the infection. Things like staying at home, working, studying have been central in our discussion. And of course we see especially not looking per se at the energy generation aspect, because of course we can see energy has, energy needs in general across the world has dropped drastically. But looking at the aspect of especially the residential aspect, the issue of reliability and affordability is still a key, and looking at clean energy altogether. So for the situation, if we look, COVID has impacted quite a lot when it comes to energy access. We have witnessed very positive trend to reduce the number of people having no access to electricity, for example, across the globe. And over like 13 years, there has been a very good progression towards getting down to reducing the number. For example, looking at the International Energy Agency reports, for example, they talk about people without electricity did it drop from 860 million back in 2018 up to 770 million in 2019, just one year. Looking at sub-Saharan Africa, 600 and back in 2013, there was 610 million people that have no access to electricity. But again, all these trends, which are very positive, they are very likely to increase because of the COVID pandemic, because of the shift of priorities of the financing aspects. And all this actually boils down to making hard for the achievement of the sustainable energy for all goals, like achieving access to universal access of energy by 2030. So, as you can see now, lack of electricity, reliable electricity supply in the urban poor communities has impacted issues of the healthcare during the COVID-19 pandemic. If I remember a friend of mine did lose, his relative like 2 weeks ago because, he was in the ventilator, but again, suddenly, they were, depending on diesel genset, suddenly the diesel actually, went off. And of course, much as they were struggling to do something, and then he died. I mean, so you can see the magnitude of the problem if we don't we don't look at the reliability aspect. And so increased access to energy is pretty much central, and contribute to all sort of issues, include healthcare services, education, recreation, water supply, and domestic applications. In the health care, as I said, I mean, we do power the ventilators and everything. And education, people are studying from home, and that actually, of course, again applies to those people who are working from home, which is massively happening. And the domestic services, again, they are pretty much impacted, especially talking of energy for cooking. Issues of indoor air pollution can also now be considered differently. There's a huge number of low-income dwellers who can neither afford the connection fee or even the bills, much as we talk about most of the urban areas have got access to the grid, like 80% or 90%, even in sub-Saharan Africa. But still, these people cannot afford even to connect. I mean, they the cables are running across the vicinities, but they cannot even connect. And even those who are connected on special programs, for example, they cannot even meet their energy bills. So the central law of energy access really is to really build back better. And if you, I mean, the Organization for Economic Cooperation and Development, OECD, has really emphasized that building back aspect in their report last year, mainly to align issues, now take advantage of the COVID to embrace the net zero aspect on the GHG emissions, but also strengthening the climate resilience and innovation. And all of these actually boils down to enhancing the well-being and innovativeness and inclusiveness of the people. And so again, the UN Secretary General policy brief actually calls for conscious policy choices, particularly with respect to inequalities, low capacity, and green economic recovery. And the UN Habitat Executive Director, back in last year on the Habitat Day, she really emphasized the need for joint forces to respond to the current crisis and share solutions, create cities for the future of everyone. And decentralized energy options seems to be the most plausible solution, because now even the grids can, the major infrastructure for energy, for electricity, they cannot afford to, power their systems while there's no such huge demand. So the centralized energy systems is very important, especially for the reliability aspect. Things like solar PV and other potential renewables do play a crucial role. And of course, the issue of enhanced technology of digitalization and Internet of Things also play a very central role here. And on the social aspect, looking at it positively, people, they learn how to change lifestyle with the low energy consumption, for example. And, in this case, we are able to also, fight the pandemic, but also look at the opportunity to prepare for the fighting for similar infectious disease in the future. But in the same time, we are also saving energy. And consequently, we do promote resilience and circular economy. And UN Habitat on its side, it's trying to pretty much also align with the COVID pandemic and prepared some response actions. And there is actually a web-based platform where you can see real-time global infections, which can be seen as on the slide. And on the COVID-19 habitat response, it has brought a new dimension of health issues in the humanitarian settlement design and planning. And UN Habitat is currently revising new urban planning and design systems to put in emphasis on health crisis management, like natural ventilation, avoiding crowdedness, like proper planning, proper open spaces planning, handling of municipal waste, local production of goods, and zero-kilometer approach. But of course, the possibility of having decentralized energy systems. And this ends my presentation. I'd like to really thank you very much for having me. Thank you. Good morning.
Great. Thank you, Emmanuel, for that. I'm glad that we were able to get your presentation, your pre-recorded presentation working properly. So I'd like to thank all of the panelists, right, for their presentations and for taking the time today. We do have time for questions right now. And so I know that I've put some questions in the chat, but I'd like to open it up to anyone else who's joining us who has questions that they would like to ask the panelists. And if not, then I'll turn to some of the questions that have already been placed into the chat. So if people do have questions, I invite you to ideally turn on your camera so we can see you, and to turn on your microphone and to ask any of the presenters questions that you may would like. Are there any questions from the audience? All right, well, I will start, I guess, and just my first question that I asked in the chat, which was for Reynes. So Reynes, I found that very interesting to kind of look at the perspective of the private sector and business and the response to COVID through corporate social responsibility. And I'm curious, in your research and your literature review, if you found differences across industries, if some industries were maybe doing a better job or more active in promoting CSR in response to COVID, and if there are any responses that you found successful.
Great, thank you for the question, sir. For the first question, with industry specifics, during my research, what I found out was the only industry that has done a good job is the construction company, is the construction industry in South Africa. And that is because the initiatives were done proactively. It was done before the COVID-19 started. So it's like during the COVID-19, before the COVID-19, construction companies in South Africa, as they have channeled their CSR activities towards building good social amenities and other infrastructures such as hospitals, playgrounds, and other stuff for the community, for the various communities. So when the COVID-19 happened, all these amenities just came handy. So they were proactive before the situation actually started. Unlike other African countries, which did not have these proactive CSR activities. So when the thing happened, all the various industries in various countries, what they did was, everything they did was actually reactive in response to the situation. So it didn't give that much impact. It was just, they were just mimicking stuff to see whether they can handle the situation. But actually, the best way to go is the proactive CSR activities. So that is what I found out during my research. So on top of that, I would say that the best way, during my research, I didn't find any industry with such proactive CSR activities aside the construction company, the construction industry in South Africa. And to the second question that someone asked, with my situation in Shanghai, have I found any? The question is, excuse me, can I read the question again?
Sure, I have it here. I can say
okay,
it.
Given your current situation as a student in Shanghai, are there examples of CSR in response to COVID-19 that seem to be working well in China or in the international context? Yes, of course. As a student, during the pandemic, we were actually confined. It was a lockdown, so I couldn't find more. Just like in the research, that is actually one of the problems, because the pandemic is ongoing, so it is actually difficult for researchers to find accurate information as the pandemic is ongoing. So I put that as a future work that I'm gonna do. But what I found out during the COVID-19, when it is at its height, I heard about this Japanese company. This Japanese company, I think it is Toyota Bushoku. They provided some funds to the Chinese for those people that were recovering, those initial recoveries from the COVID-19. They were paying, they actually gave 400,000 renminbi. That is approximately 6 million Japanese yen to be paid for the expenses, hospital bills and stuff for the very initial recovery. Those that were recovering from the COVID-19, they were actually paying their hospital bills. Aside that, the aftermath, it is not actually the aftermath, but when the vaccine was created, yeah, I don't know whether it is the school, my school, or whether it is from the government, but they were providing free vaccines for students. They're providing free vaccines for students. So, I mean, everyone was rushing for the vaccine and it was scarce and stuff, but as their CSR activities, they gave it out to students, which was a very good thing to do, and that worked perfectly. It got a lot of people, a lot of students getting vaccinated at the initial stages. And also, the government of China, I think, gave free vaccine. It's still ongoing. They have selected some African countries which they are giving free vaccine. So initially, from my experience, I heard people saying the vaccine is expensive and they cannot get it at this moment, so they're waiting later, maybe it will be free and they can get it and stuff. So like, as people are lagging behind in taking the vaccine, so the disease go on and on. So I think it's a good initiative for pointing out some people that cannot afford the vaccine to be given the vaccine for free. And that works. Now I know a lot of people who initially said they ain't gonna take the vaccine for the time being are now vaccinated, which goes a long way to cut down the spread of the disease. So that is, in my experience, what I found. Thank you.
Great. Thank you very much. It's very interesting to see the various responses that are happening internationally. While you were speaking, I had Manuel reached out, and I guess his co-author, Vincent, would like to contribute a little bit more to the issue around the importance of energy access. And so Vincent, I'm turning it over to you.
Thank you very much, Jan, and thank you very much, colleague, and congratulations, of course, to ICCCASU for organizing this international conference despite the COVID pandemic. I just want to say that in response to the question you asked, what has been the role of the civil society organization and also the private sector in the COVID response? I want to say that we have seen, particularly in African countries, how the private sector came together to provide some relief food to the urban poor that were not able to have any income activity during the COVID. I was seeing, for example, people gather together, providing them food, some essential amenities so that they can survive. No? And then the other thing that the power company also did, they decided not to interrupt any electricity because of not paying for the bills. And this was very, very important because at least for 1 year, people could accumulate their bills, but they could survive. Because just imagine if you are already you don't have access to electricity and someone just come and then cut it, and yet you are not working. So this was a very good reaction. Now, in terms of the civil society organization, they have also organized to distribute, for example, to allow for some essential goods, for example, charcoal, to reach out to those who are in the need. And also because with the curfew and also locking down cities, only essential goods could pass. So there were quite a number of points. But what I just want to highlight here, in addition to the presentation we made, that COVID also provided opportunity. COVID also showed how it is important to rely on resources that are locally available. Because during that time, with the lockdown, each country was has to survive without any connection with external. And that is why we believe that the policymakers today need to really invest on on any solution that are endogenous solution. For example, and of course, solar energy, wind energy, those things that are available locally, we need to really invest on it and increase access and also increase resilience of the population. So those are some of the few points. We really need, and this opportunity was shown by the COVID, because it really shown that during COVID, you cannot start a city or a country in the south, start calling the country in the north and say, please come and help us. Each one has to help themselves before looking out. No? Like in the plane, put your mask before putting your neighbor. So I think that is really one strong solution. The other point, which is also very irrelevant, was like is building back better and also back to basics. No, because washing hands are basic, but we have seen how this simple gesture can actually save lives. No, so those are the issues. So we are in essence here, we want to advocate for more access, more investment on decentralized energy option for the urban poor. Thank you.
Great, thank you very much, Vincent. And you, I think you foretold or you foreshadowed the question I was going to ask, which was kind of about short-term versus long-term actions that can be taken. Your colleague Emmanuel, I think, did a really good job of outlining longer-term energy investments that can be made to help cities become more resilient in the face of health crises through non-centralized energy grids, for example. And I think your add-on here really talked about kind of the short-term responses that are necessary as well. So thank you very much for that. I would like to provide the second presenter, Thanusha, an opportunity to respond to the question that was put in the chat. Thanusha, I'm not sure if you are able to join or if you're still having IT problems.
Yes, I can join.
Great. So the question was kind of building, and I think what we've done today during this panel is really look at the variety of outcomes from all actors in society, but building on Rainis's presentation, I wonder about the opportunities and challenges, again, related to civil society for the COVID response, in particular for vulnerable populations and different cultural groups and neighborhood. And if there are any examples of grassroots or community-led initiatives in Toronto that came out of your study.
Yes, so I'll keep it pretty short. So one of the opportunities that I found in my research, specifically for civil society and like private sector, is definitely a cultural response. And as much as we say it, we have to actually go ahead and showcase this. I've read many reports through my research, and it says that we've been integrating local opinions into our policies and whatnot. But once you go dive deeper, there's no exact telling of what this is. So being able to reach out these communities and gaining public trust by basically integrating their culture and allowing them to understand this information that allows them to feel safe. So this is definitely the case as we've seen with First Nation populations specifically. And the challenge here is that there's so many immigrants. So this is very similar to the case of my parents. So there's so many immigrants and visible minorities that refuse to trust officials because of their past interactions that they would have when they first started entering the country. And I definitely feel that tailored programming to different neighborhoods are the key. So every neighborhood is different. You can't fit a one size fits model to all these different neighborhoods, different populations. So I feel like that's definitely an opportunity that we will be able to seek. So some of the community-led initiatives that I've seen in Toronto, which were extremely effective, I've seen the 24-hour vaccination sites, which are amazing for people who are in precarious working environments. And I believe that was set up by University Health Network and a variety of other health networks within Toronto. So since the research, I've actually seen a lot of innovative approaches done by Toronto surrounding areas as well. So I've definitely seen a growth. And one of the things I liked the most when I was doing my research is that the government actually launched this vaccine community innovation challenge. So basically, community organizations come up with different innovative ways and projects that they would be able to launch for contributing to vaccine promotion, and they would be able to get funding for this and launch different projects. So I think that's an amazing initiative in itself. So my end summary would basically be making sure that each of these vaccine programs are tailored to the communities and neighborhoods that they're being implemented in.
Great, thanks. So a one-size-fits-all approach may not be successful in achieving the same results across different communities.
Yes.
Great, thank you. So we have a few more minutes here. I'll open it up to the floor. I'm not sure if anyone else has questions that they would like to pose to the panelists, or given the discussion that we've had, if they'd like to kind of maybe share best practices or their thoughts as it applies to their regions around the world. Okay, not seeing any hands or seeing anything posted in the chats. I guess in that case, I'd like to thank everybody for joining us. In particular, I'd like to thank the three presenters for their very interesting presentations. I think there's some really interesting takeaways here about the role of government, the role of civil society and the private sector in helping to build resilient cities, resilient communities. I think that the COVID-19 pandemic has created challenges, but also has identified here opportunities to increase community and city resiliency going forward. We've looked a lot at longer term and short term reactions for supporting vaccine efforts and the importance of ensuring that there is not a one size fits all, but that there are varied responses tailored to the communities in these cities. And I think it's been a very interesting conversation and giving us a lot to think about. So again, thank you presenters for sharing the findings of your research. And I hope that everyone enjoys the final day of the conference and that you're able to participate in some of the other panels going forward. So thank you very much to tech support, and thank you very much for everyone for joining us here today. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
Thank you. Bye-bye. Just join on other.
Hi, Tanisha. Can you hear me?
Yeah, I can hear you.
So you want your recording or the audio recording?
I wanted to see if I could just get my recording.
Oh, okay. But you sent me a link, like your YouTube link, actually.
Yeah, I just wanted to see the entire, possibly to get a screenshot of the entire screen, just so I can put it on my LinkedIn.
Okay.
Well, if it's easier, maybe even just sending the whole conference, the whole panel.
The whole panel. Okay.
Yeah.
So I'll talk with my superiors, and I will tell you if we can just send you the recording.
Okay, perfect. Thank you so much.
Thank you.
Have a good weekend.